Spinal stenosis. What is it? And you say you're treating it a little differently for certain patients.
Right. Spinal stenosis is basically a narrowing of the spinal canal where the nerves become pinched or squeezed in the back of the spine. Spinal stenosis occurs due to a variety of reasons, but due to aging, degenerative changes of the spine. In the past, if patients had conservative treatment of spinal stenosis and they did not get better.
Like, what are those conservative treatments?
Physical therapy, medication management, epidural steroid injections. If those patients fail those, some of those patients may end up with spine surgery or lumbar decompression. There's a newer technique known as MILD, M-I-L-D, minimally invasive lumbar decompression. That is a technique where under X-ray guidance, using a very small puncture hole, we place a little device in the back to remove some of those hardened tissues that is resulting in the spinal canal being narrowed. That allows the spinal canal to re-expand to a proper size where the nerves are not being pinched. And that is done under X-ray guidance. It's an outpatient procedure. They walk home, no general anesthesia, and it's usually a much faster recovery than traditional back surgery.
Now, people that have spinal stenosis usually know they have it. Their doctor told them. Is that correct?
It's based on both clinical and radiographic evidence. What that means is they can't walk. They have to lean forward. Pain is starting to go down the legs. The more
Why
they
does
stand.
leaning forward work for them?
Because it reduces the narrowing of the back when you lean forward.
Oh, get some relief.
Get them some relief. And they also have imaging studies, whether it's a CAT scan or an MRI, that shows a narrowing. So this is, again...
So you go in there and clean it out with like a needle?
We go in there with a very small probe, which is minimally invasive, remove some of the hardened tissue, open up the spinal canal, give it some more room rather, and they go home.
What, I mean, can you be in your like 80s, early 90s to get this done? Is there an age requirement?
There really is no age requirement. I've had an 84-year-old that was able to resume normal activities after this mild procedure in a very effective manner.
And not much of a downtime at all?
It has less downtime than traditional back surgery, which is speedy recovery.
You tell them to take it easy for like a couple of weeks?
That's right.
And then they're back?
Within a few weeks, patients start feeling some evidence of relief.